After a rocky few months, the first wave of health insurance coverage kicked in under the Affordable Care Act. But the fight over the law is far from over. ABC 12's Washington correspondent Lauren Adams has the latest from Capitol Hill.
If you like your health care plan, you'll be able to keep your health care plan.
That was the president's promise. Then came the disastrous rollout of healthcare.gov in October, which left the Obama administration scrambling to fix glitches and get people to sign up for insurance coverage. But after all that, more than 2 million people did sign up for health insurance, and as of January 1st, all 2 million are covered, theoretically.
It's going to take quite a while to get the mechanics of it fixed.
Ed Heiselmeyer is a senior research fellow at the Heritage Foundation. He says in many cases, insurance companies have incomplete, lost, and missing information, which means a lot of people who thought they were covered are actually not. But he says those aren't the only people who will be dissatisfied.
The design of the law upsets a lot of arrangements that a lot of people had in place, particularly a lot of Americans with employer-provided insurance.
But Mike Tanner, a senior fellow at the Cato Institute, says it's not all bad news.
No doubt some people are going to get coverage that didn't have coverage before or get better coverage than they had.
Many of the 2 million people who enrolled didn't have any health insurance coverage before, and that trend is expected to continue over the next few months. Both Heiselmeyer and Tanner say the debate over the Affordable Care Act will continue in 2014, and the future of health care in the United States is unclear.
This is going to keep popping up throughout the year.
It may be something that builds on this law. It may be tearing this down and going in a completely different direction. We may have more of a single-payer system or more of a market-based system, but I think that this law is going to change.
Right now, though, the law says you must be enrolled by March 31st or you may face a fine. And while the battle over the Affordable Care Act is expected to heat up in 2014, experts don't see Republicans and Democrats finding any common ground on the issue. Reporting in Washington, I'm Lauren Adams.